Now, going back to traits, one of the keystones about personality that we like to think about is that personality is relatively stable. And it turns out that there's only partially true. Yes, there is a lot of stability when it comes to our personality characteristics. However, there is room for change. And there are certain kinds of change that seem to be fairly common. It's fairly common that positive traits increase over adulthood as you become more mature. When you think about it, as you get older, you might find that the things that worry you and bother you right now as a young person don't seem quite as important when you get older. And as a result, you kind of don't get upset over things like that, over little things. You don't sweat the small stuff when you are getting older, as you might do when you're younger. So you kind of feel more positive. You're not trying to show off to anybody anymore. You know, so there's a lot that changes in that respect when you get older. But again, it's so one of the changes noted is positive traits seem to increase. All right. Well, one of the important things to do when it comes to studying personalities, we have to find a way to measure it. We have to find a way to assess personality. I can't just take a photograph of someone and know what that person's personality is. I need to be able to delve deeper into it. Well, one way in which we can assess personality is through self-report tests. I give you a questionnaire. How you answer the questions on the questionnaire indicate what your personality characteristics are. Asking you about your social habits, how sociable you are, would indicate your answers to questions regarding that would indicate your level of extroversion, for example. So when we have to talk about the Big Five traits, there are a number of different measures that look at the Big Five. The NEOPI, for example, is a well-known self-report scale that measures your scores on those Big Five traits. One problem with self-report tests is the problem of social desirability. And this is a problem that has to be dealt with when you design your questionnaire. Social desirability is the tendency for people to respond to questions in ways that make themselves look like they are normal, good people. Okay? Well, not every one of us is normal and good, and we're certainly not normal and good all the time for every circumstance. So if we're answering questions on a questionnaire and we are hindered by the social desirability bias, we are going to tend to answer the questions in ways that make us seem like nice, good, normal people. The problem with that is when you're doing that, you are not telling the truth about your personality. So what do we do? What do we do? What do we do to deal with social desirability? One of the things that we can do is in the way we ask questions, we can ask questions in a way where no matter how you answer it, you're not going to look like a freak. Okay? If we ask people, how many people have you beaten up lately? You know, maybe that's not a nice thing to say. Oh, I don't beat people up, whatever. But, you know, if you ask people questions in a different way, that might kind of get at maybe how aggressive a person might be, for example. You could ask a question like, you know, if someone hits you, how likely are you to hit them back, or something like that. And, you know, how you answer it may not necessarily mean you're abnormal. It just means you're looking at differences. And it's hard to do, to create questions that don't elicit that emotional, oh my God, I better answer this like I'm a normal person. So that's one thing you can do. Another thing you can do is when you give out a self-reports test, you make it anonymous, so no one will know who, you know, what your particular responses are. That way, you feel you can be more honest because you know that they're not going to link it to you with your name. So making it anonymous, getting rid of those emotionally laden questions. Try to be as neutral as possible in terms of how you're asking the questions. And that is one of the things you do. It's still going to have social desirability, but that's a way to reduce it. Another important way to reduce it is sometimes they create self-report tests that are called empirically keyed. And what these are is they are designed, the questions on this particular test, on the face of it, do not appear to be like anything like what is they're trying to measure. So basically, if the test taker doesn't know what's being measured, then they're not going to try to game the test because they don't really know what's being tested. They're going to be answering a bunch of questions that may be seemingly unrelated to each other, and you're not going to get a chance necessarily to see it as something. You got an opportunity to behave in a socially desirable, answer in a socially desirable manner. So the items on the test do not appear to be related to the test. Now, and I'll give you an example. One of the most well-known examples of an empirically keyed test is called the MMPI. The MMPI stands for Minnesota Multiphasic Personality Inventory. 567 items, and it does control for social desirability. And it's used to assess mental health. It's used to assess whether or not a person has depression, whether or not a person has OCD, and it's also used for other purposes as well. But basically, the way you answer the questions, what they've shown is that people who are depressed answer these particular questions in a particular way. The questions by themselves do not look like they have anything whatsoever to do with depression. Likewise, a person who is depressed, who is taking the test, and maybe doesn't want to portray the fact that they are depressed, they're not going to be able to game the test to make that impression, because the questions, it seems to be typical of how depressed people answer those questions, but the questions themselves do not clue anyone in as to this is a test of depression. And the NEOPI is the test for assessing the Big Five, the five-factor model: openness, conscientiousness, extroversion, agreeableness, and neuroticism, for those of you who don't remember. Another popular measure is the Myers-Briggs type indicator. And this essentially is identifying different personality types, and they use 4 dimensions here: extroversion, introversion, sensing, intuiting, thinking and feeling, and judgment, perception. This test is actually based somewhat on Carl Jung's theory of personality. With Carl Jung, we have these dualities that opposing parts of each other, like the animus and the anima, for example. And we also have introversion, extroversion. So it's kind of based on that model. And how we interact with the world, sensing, or we intuiting. So, these are kind of things. Now, the thing about it is, this test has had its share of critics. It hasn't. The research evidence has been mixed on this particular type of test, and there are similar types of tests like this. However, and you can make the case that the Barnum effect plays well into this. If you take this particular type of personality test, you can even just Google it, and you could find a type of test like this that you could take online. The results you get is a description of a particular personality type based on those 4 dimensions. So, extroverted, intuiting, thinking, perceiving, for example, as one pi. So it could be like EIFP, for example. And the EIFP, for example, has a particular profile, a description of what this person is like. However, the description is kind of vague, and it can fit lots and lots of different people. So you could take the test and be given any one of those responses, and you might say, yeah, that sounds like me, that sounds somewhat like me. So as a result, you tend to believe it because there are some things in that description that are familiar to you, You might think of specific circumstances that match what that description says. So bottom line is, it's going to essentially make you think that, oh yeah, that's a perfect description of me, when it really is just a general, vague description that can apply to many, many people. So you got to watch out for that. Now, if you remember back when we talked about Freud and the influence of the unconscious, even Jung and the collective unconscious and so on, or Murray, when we're talking about needs, we're talking about the underlying hidden needs in the unconscious that are guiding our behavior, like a need for affiliation. Well, you can't just give someone a questionnaire and have them fill out their answers to the questions and expect that that will tap into those underlying processes. So thus is the purpose of projective tests. The psychodynamic approach uses these projective tests to show how the unconscious can be projected through onto the responses based on responding to ambiguous stimuli. So it's not a simple, answer this question and here it is. You might be asked to look at a set of pictures, and on each picture, describe what you see. What's the people thinking about? What are they doing? And your story about each picture combined together might give an indication of what might be going on, what might be your underlying needs, for example. One popular test is the Rorschach test. You look at a bunch of ink blots and you are told to tell me what you see. And the images, the things that you describe what you see kind of are an indication of your personality, underlying personality. So it's projected onto that, your description. You might be noticing like areas of the ink blot, or you might be describing the ink blot in general. You might be noticing the colors of it, how you respond. There are certain ways of scoring it. However, it is kind of vague in terms of being reliable. It's not a very reliable one. It's a lot based on the interpretation of the test giver too. So the reliability and validity of the Rorschach test is pretty questionable. Now, the thematic apperception test is a test that looks at, where you look at a set of pictures and your description of what you see in those pictures is essentially shows what your underlying needs or your underlying thoughts might be. So, how you describe what is going on in this picture, describing the man and the woman, what they're thinking, what they're talking about. Your underlying needs might be expressed in your interpretation. Again, to see each picture one at a time, and you respond to it. You make your responses to each one. So when you look at each picture, the stories that you make for each picture, combined over a series of pictures, would reveal your personality, your underlying personality. And again, it's based on your stories about it. So in other words, they're not asking you direct questions. So in this case, it prevents social desirability, because you're just going to build your story, and your story is going to be interpreted. If you want to see an interesting example of this type of test in a movie, click on this link here and you'll see it.
Good morning.
Morning, missus.
How are you today?
Fine.
Good. May I? I'm Dr. Taylor.
Haven't seen you before.
I'm your psychiatrist.
Psychiatrist? Do I need one?
Just part of hospital routine.
What are we going to do? Talk about your sex life?
No. I'm going to show you some slides, and you're going to tell me what you think about them. All right?
Oh, jolly good. Do you know anything about dreams?
Something, yes.
Do you know what they mean?
Perhaps. You concerned about something?
No, I'm not concerned really, but I've been having this very nasty dream. Very nasty. It's like, well, when I was all smashed up, you know, and half awake and unconscious, I kept having this dream. And like all these doctors were playing around with me Gulliver. You know, like the inside of my brain. I seem to have this dream over and over again. Do you think it means anything?
Patients who sustain the kind of injuries you have often have dreams of this sort. It's all part of the recovery process.
Ah.
Now then, each of these slides needs a reply from one of the people in the picture. You tell me what you think the person would say. All right?
Righty, right?
Is the plumage beautiful?
I just say what the other person would say.
Yes.
Plumage beautiful.
Oh yes, well don't think about it too long. Just say the first thing that pops into your mind.
Cabbages, knickers. It's not got a beak.
Good. The boy you always quarrel with is seriously ill?
My mind is a blank. And I'll smash your face for you, your buckos.
What do you want?
No time for the old in and out, love. I've just come to read the meter.
Good. You sold me a crummy watch. I want my money back.
You know what you can do with that watch? Stick it up your ass!
Good. You can do whatever you like with these.
Eggy Wax. I would like to smash them. And pick them all up. And throw them out! Fucking hell.
Oh, there. That's all there is to it. Are you all right?
Hope so. Is that the end then?
Yes.
I was quite enjoying that.
Good, I'm glad.
How many did I get right?
Oh, it's not that kind of a test. But you seem well on the way to making a complete recovery.
When do I get out of here then?
I'm sure it won't be long now.
Well, as you can see, Alex, the character in the movie A Clockwork Orange, was taking kind of a version of the thematic apperception test, and his responses were recorded by the doctor in the movie. Okay, another way in which personality can be assessed is by direct observation of behavior. And again, this is a good way of judging patterns of behavior that might reflect a person's personality. Cognitive assessment of attention and memory, so they basically, testing your mental processes. Getting peer ratings is a good way of assessing personality. Interviewing friends and family to find out what they know about your personality. So this is essentially the personality that you are projecting to other people. Other people would be able to essentially tell a researcher about your personality based on what they see of you. There are psychophysiological measures like the polygraph test, measuring, the skin conductance, heart rate, and whatnot. And again, there's some. This is again the biological aspect of personality that would be looking at, what biological processes are going on when a person is thinking this or doing that. And of course, brain imaging, the MRI, is very useful at being able to reveal what is going on in your brain, and especially being able to match what is going on in your brain with maybe some thoughts, feelings, and behaviors you might be reporting. Well, it turns out that there are some personality traits that are indeed correlated with good health. Conscientiousness is one of them. There's been research to show that this is the case. Well, a conscientious person is responsible, they're reliable, they are steady, and these kind of characteristics mean that perhaps when it comes to healthy eating, exercise, that people who are high in conscientiousness are going to do what they're supposed to do when it comes to eating healthy and exercising properly. The characteristic of having a high degree of personal control is also relevant when it comes to your health and wellness. So a high degree of personal control would indicate that you essentially believe that your outcomes are your responsibility. You're not feeling as if you're controlled by forces that are outside of your control. So in other words, if you feel like you've got some control over your life in the decisions you make, it kind of makes you feel like you're more powerful, and it makes you feel better about yourself. It also helps you deal with failure. If you feel like failure, you say, well, all right, I'm responsible. Now I can go ahead and do what I need to do to get better at that. Self-efficacy is extremely important. The belief that if you were to attempt a particular task, you will get the results that you expect. So if you study, you will do well. In other words, if you believe that those things will go together, and you believe that you are capable of doing those things, then that's going to help you as well. Finally, optimism is a big one. Optimism is very much connected with good health. If you have a general belief that things will turn out okay, then you will generally be less likely to suffer from health problems. It allows you to deal with setbacks because essentially you say, well, things will turn up again later. Now, the type A and type B behavior pattern is related to health. People who have the type A personality, the hard-driving, aggressive, hostile personality, these are people who are actually at risk for some health problems, particularly in their heart problems. So if you're always like staring at your watch, impatient and angry, you say, God, will these people stop? Would these people move? So if you're one of those growling, yelling people when you're in traffic, that might indicate a type A behavior pattern that actually might be harmful to your health. Type B is more laid back, more relaxed, and that's definitely been more related to good health. Our subjective well-being is something that is studied in a lot of research. It's our basic view that our positive affect is greater than our negative affect. We have more positive emotion than negative emotions, and our evaluation of life is pretty good. So if we have a high subjective well-being, then we believe our life is pretty good, and this characteristic is very much predictive of good health. So I hope you all have a nice high sense of subjective well-being.